Namaste friends, welcome back to our channel. Today we are celebrating World Heart Day 2025. On this eve, let us discuss about the status of the world cardiovascular diseases that are spreading across the globe and which is becoming one of the common cause of death even among the younger individuals, more so in India. Now, why the World Heart Day has become more important this time. The World Heart Day theme of this year is Don't Miss Heartbeat. So the meaning here is prevention is better than cure. So by knowing more about your heart, you can prevent the possible upcoming complications. That is the focus. So always prevention is better than cure. So this World Heart Day, we strongly recommend how to prevent the possible future cardiovascular diseases. The major goal here is to focus on lifestyle modifications. We all know the lifestyle modifications in this era are slowly deteriorating. The people are becoming more sedentary, they are having more of the junk food, and their lifestyle is filled with a lot of stress. These factors are affecting their health very badly and causing early complications or early events of acute coronary syndromes happening. As a healthcare professionals, as you could be a doctor, you could be a nurse, you could be anybody, you have some responsibility to discuss these matters to the patients, because whenever patients comes usually to us, they come with a complication more often. Only if you come in the early stages. Okay, if they have come in the early stages, it is become our duty to inform the patients about the good lifestyle practice, what all they have to do. They need to be told the diet they have to consume. They need to be told how much exercise they have to do. Prescribed exercise is at least 30 minutes of brisk walk, and some isometric exercises are also required. Along with this, they have to have a very balanced diet. So as ICMR recommends, the balanced diet is for India is your carbohydrate intake should not be more than 45% of the calories. That means the focus is in reduction of the carbohydrate intake, and your protein intake has been beefed up. You can increase the protein intake, and again on the fats it should be reduced. So the more go-to is to increase the carbohydrate. The carbohydrate, when I say, it is complex carbohydrate, not the simple sugars. Complex carbohydrates do come from the vegetables. These vegetable consumption can lead to a good intake of carbohydrate. That is, to get them is usually by vegetables. The recommendation is at least 400 grams of vegetables and 100 grams of green leafy vegetables are to be taken in a regular meal. And you need to take a protein, high quality protein. This protein can be obtained from the plant kingdom or could be from the animal kingdom. Of course, the quality of the proteins that come from the plant animal kingdom is superior, but it doesn't mean we can't get from plant kingdom the good quality proteins. You can get there. You can get it from paneer, you can get it from tofu, you can get it from the pulses, and also you can get it from some legumes. These are the things from where you can obtain the plant derived proteins. And if you are a non-vegetarian, of course, if you are a vegetarian, you are not taking non-veg, vegetarian, the albumin is also a good source of protein. And if you are a non-vegetarian, the chicken which is a non-red meat, I am telling you, non-red meat, which gives good quantity of protein. So, but we tend to avoid red meat like mutton and beef are usually not prescribed. Of course, you can take fish. So, among the non-vegetarian food, chicken or fish is acceptable, but going for a mutton or a beef can increase the intake of the cholesterol. So that's the reason there is some amount of limitations here. When it comes to protein, I said carbohydrate, I said this, and the macronutrients, you can see the daily, if you are able to go in the sunlight, you can obtain the vitamin D3. And if you are strictly vegetarian, not even taking milk, you can have a deficiency of vitamin B12. So probably we'll have to take some amount of supplements from that. So total even avoiding some people call as vegans. I'm not taking vegetarians, vegans. The vegans are the people who doesn't even take any animal product, including milk. So if you are in that class, then you can have issues with vitamin B12 deficiency also. Probably you'll have to take some extra supplements for that. And if you're not going much in the sun, your vitamin D3 levels also can come down. Probably you may require replacement for that. This kind of healthy food style is important. So now the calorie intake is one of the important factor which determines your weight. So for any weight management, it is the calories, amount of calories and the distribution of this fat, protein and lipids. These factors matter most in the weight management. So naturally, you of course exercise do help in a reduction of weight, but the 80% of the job is done with the help of quantity of reduction of calories. Mind you here, if you are reducing the calorie intake, see to it that your carbohydrate percentage doesn't go up. If the carbohydrate percentage has gone up without properly distributed protein, still you may not be able to lose the weight. So the whatever proportion of prescribed, not more than 45% of carbohydrate has to be followed, with the quantity of the total calories consumed per day. That is the one thing about the diet. More often we find in the medical practice, the details of the discussion of the diet is hardly done to the patients. Patients are given tablets, they are just given 1 or 2 instructions are sent home. But actually the major issues with the patient health is diet. This imbalanced diet is not just going to have metabolic, it's going to in fact destroy the microbacterial flora of the intestine, the normal commensals, if they are not taking the proper distributed diet. And this can cause havoc when the normal commensals in the intestine are distorted or destroyed, and the abnormal commensals come up and they will release a lot of stress related endotoxins into circulation, causing the plethora of inflammation in the body. So the whole body can get inflamed. So what you eat will end up with the body getting fully inflamed. It's just like a burning. So this can trigger a plaque rupture somewhere in the brain or somewhere in the artery or coronaries, and you can end up with the acute coronary syndrome. So we need to have a very balanced diet so that these inflammations doesn't happen. That is one thing. Also, they can develop a fatty liver. There are many complications. And there is one more common disease which are very often seeing is obstructive sleep apnea, which is there. Its incidence is being found to be more and more. Whenever you evaluate the patient, you ask the patients. More often we don't ask details of the patient's sleep. Patients do complain of some sleep problems, and the consultants usually prescribe some sleeping tablets and are sent up. But the actual issue, the underlying problem is not really dealt with. If the patient is complaining of sleep related any issues, it needs to be evaluated, at least with sleep study. This is one important thing we need to focus. So we need to change the way we practice, like these things, like these gadgets, like adding sleep study and asking to check for the blood pressure, continuous blood pressure monitoring, continuous blood sugar monitoring. These newer technologies are to be included in the patient's management to give the better prevention or a possible happening of the future attacks. And as a doctors, and we have the responsibility to implement this in our practice. I do understand whenever you are trying to implement any new kind strategy in your practice, just asking the patients to go for a sleep study, it takes a lot. The patients will not easily accept it. Patient may say, I don't have much issue, why should I go for a sleep study? And if the sleep study prescribes and CPAP, which patient has to wear, the patients usually reject it. And it needs a lot of counseling to convince the patients, to explain the benefits, and it is really a difficult task. It is a pretty difficult task. This kind of things are better dealt with the specialists who are trained as a team to make the patient accept the treatment. Because unless the patient has been told that he properly the benefits, the advantages, the long-term complications that he is going to get, this implementation of this therapy, because sleep study, OSA, obstructive sleep apnea, treatment is a CPAP. He has to wear the mask and sleep. That it initially, the most patients I have found is 80% of the patients will reject it. I don't want that health or whatever, but he doesn't want to sleep with that mask sitting on his face, because it is a kind of a nuisance in the early stages. It takes some time, at least a month, sometimes 1 to 2 months, to accept that as a normal way of sleeping. There's that 1 or 2 months of accepting is a challenge. Once the patient accepts it, usually they continue. And we do have seen many patients who are having CPAP wearing for 14 years, 15 years, 18 years. And this most, what I have found, to tell you frankly, CPAP acceptance in the doctors community is more than the non-doctors community. Because this is because the doctors do know the complications, and they will be willing to take that initial pain to prevent the longer complications. But our patients are more short-sighted. They're not that much dedicated. They don't understand the possible complications that can prop up in the long term. Convincing a patient, if he's from a village especially, and if the village there is an electricity problem, in such a patient, convincing for a CPAP is very difficult. This has come with my experience. Usually I send them to a specialist, go and get yourself treated for OSA. When there also the same issue happens, whichever struggle they'll try to convince the patient. Patients may buy the CPAP, but still it will dump. They don't wear it. This is one common thing which we are seeing. So as a theme, I told prevention is a focus this year for the heart attack. That's all today, and happy World Heart Day. Thank you.